Hi, I'm Dr. Joshua Kantritz. Thank you for taking a moment to watch this video made by the providers at NVRH. The goal of this video is to provide you with information about infant feeding and the support you can expect to receive from our staff during your pregnancy, hospital stay, and even after you've gone home. We are not here in any way to pressure you about the choices you make on how to feed your baby. We have found that many of our patients have the same questions and concerns about breastfeeding, and we hope that this video will help you gain a better understanding of what to expect in the hospital and help you make informed choices about feeding your baby. Thank you for taking the time to watch.
Hi, I'm Anil Lalong, one of the midwives here at NVRH, and we decided that we're going to do a little chat about the benefits of breastfeeding. How does this wonderful source of sustenance help this child? It's been documented that there are decreased rates of ear infections, respiratory infections, gastrointestinal problems, and also the long-term benefits that this child will take into his or her adult life of decreased risk of diabetes. And again, for the immediate stage of life is a decreased risk of SIDS. So it's the perfect food for a baby.
I'm Kara Pitt. I'm one of the obstetricians here at NVRH. And nature is a wonderful thing. Breastfeeding does have a lot of advantages for moms. After delivery, it helps your uterus contract, so therefore decreasing the amount of bleeding post-delivery. Also, it helps you reset your body after delivery. It can help reduce blood pressure, cholesterol, type 2 diabetes, and rheumatoid arthritis. I think another advantages that moms love is that it helps you get back to your normal pre-pregnancy weight faster. It takes more energy to breastfeed, so it's easier to lose weight for that. Some moms also get a lifetime reduction in the risks of breast cancer and ovarian cancers as well.
Hi, I'm Lori Despins. I'm an LPN here at Women's Wellness.
And I'm Kathleen Mulkern, and I'm a certified nurse midwife here at the hospital.
So Kathleen, what is skin to skin?
Well, skin to skin means that after the baby's born, you place the naked baby on your bare chest and cover the baby with a nice warm blanket. And it helps to regulate the baby's transition to life outside the uterus. And it helps to regulate the baby's temperature, helps to regulate their breathing, and it helps them to familiarize themselves with the breast and begin to breastfeed. Lori, are there any safety thoughts that we should be taking into consideration?
Yeah, you should always make sure that you can see the baby's face so that you can make sure that they're still breathing. So Kathleen, are there any added benefits to skin contact?
Yes, most moms and dads say that it's a really nice bonding time to be able to keep your baby close to you, and the baby can hear the mom's or dad's heartbeat, and you can really look into each other's eyes after the birth, and it's a really nice close time for the family.
Hi, I'm Dr. Ann O'Connor, and I would like to speak to you about rooming in. Rooming in is when the baby stays in the room with you while you are in the hospital. It has a lot of benefits. Primarily, it helps the baby be more calm. Parents learn about their baby when they're rooming in. They learn about the baby's feeding cues. They learn about what works for the baby, what doesn't work for the baby. And babies learn to recognize their parents when they're rooming in. Some folks are concerned that rooming in means that they'll be too tired to care for the baby. The fact is that the nurses are here, especially to help you if you get tired.
Hi, I'm Jade Kaplan. I am one of the nurse midwives here at Northeastern Vermont Regional Hospital and Women's Wellness Center and the Birthing Center.
Hi, and my name is Sarah Berrien. I'm a family physician and I work at the Concord Health Center and also at NVRH.
We should feed a baby when they're hungry. And the way you know that they're hungry is because they give feeding cues. They start moving their lips and fluttering their eyes and bringing their hands up to their mouth and making sucking motions with their tongue. These are early feeding cues. And you want to feed a baby when it's giving early feeding cues because the baby is not upset, is more likely to be organized enough to get onto the breast, latch properly, and suck effectively. And if that happens, then you don't get injured and your breasts don't get sore, and the baby has a really good experience at a meal. And they'll get just the right amount that they need. When they're full, they'll stop suckling, and you avoid a terribly fussy moment.
Usually you know when the baby's had enough, when the babies either will just come off the breast, often falling asleep in the process, because they're now well fed and content. And that will happen, sometimes it's after feeding for 10 minutes when they're very young. Sometimes it can be 20 minutes per side. As they get older, they will little by little be feeding more efficiently and also feeding longer periods of time. And they will often have these cluster feeds where they'll feed for several times within a 2-hour frame of time, and then they may have a 3-hour nap after that. So you're basically depending on the feeding cues that you talked about to know when the best time is to feed your baby. And then another idea, or another way to know that your baby is getting enough is how many times they're peeing and stooling. So a baby who has just been born is going to pee 1 time a day for the first day, twice the second day, third day, and so on until they're peeing about 8 times a day. And then with stooling, they will often stool in a similar fashion up to 4 to 8 times a day, depending on the baby. Colostrum is the first substance that our breasts produce, and it's very high in antibodies and protein, and it helps protect the gut, the baby's gut, to keep away harmful bacteria that they're exposed to soon after birth. And it's a thicker substance. It looks a little different from the mother's milk, and then that will be produced the first several days after the baby is born, and then you'll switch gradually to milk production.
Hi, I'm Dr. John Race. I'm one of the family doctors here at NVRH.
And I'm Dr. Elaine Stasny, one of the pediatricians here. We're here today talking about position attachment for your breastfeeding infant. Why is that important, John?
Well, it's important that so the baby will get enough milk, of course, and so the mom's milk supply is supported. It also reduces the pain and soreness associated with breastfeeding. So what your baby needs is to have a really wide open mouth, and you want to let the baby take as much as the mom's breast in as possible.
That's right, and you do that by aiming the baby's nose to your nipple and bring that baby right close to you, supporting his head with your hand and having a pretty straight alignment with that baby's body from across your chest.
So how do you know if you have a good position?
So the baby should come to the breast nipple to nose position with a wide open mouth and keeping the baby in a belly to belly position across your chest. And also the baby should be relaxed and actively sucking. How else do we support mothers and babies in our institution?
Well, all of us are really here for you, from the obstetric staff to pediatric staff to nurses and lactation consultants. And we work with community resources, including home health and WIC.
And we also support you actively as outpatients in our offices and in the communities, even in your homes.
I'm Dr. Mark Price. I'm a pediatrician who works in St. Johnsbury, Vermont.
I'm Simone Lesek-Chenin, a family practice doctor who works in Wells River, Vermont.
Simone, parents will sometimes ask me about using pacifiers in the hospital or giving their babies a bottle and using a nipple. What are the thoughts about that?
Well, Mark, the first few weeks of establishing nursing are really important for moms and babies. And if your plan is to exclusively breastfeed, we definitely recommend not using pacifiers or bottle nipples in those first few weeks. And there's a few reasons. The baby is learning how to nurse and really has to learn how to use its muscles to correctly nurse from the mom. When it uses a different nipple, it's using different muscles on that nipple, and the flow from milk from a bottle is also very different, so it's really not getting the feel of the nursing. It's also harder for mom to learn because they're not paying attention in the same way to the baby's cues, and they're not learning how to position the baby and how to really do that nursing. So we definitely recommend trying to exclusively use the breast in those first few weeks.
What about giving formula to the baby? Is that a problem?
Well, if, again, your goal is to exclusively breastfeed, then we don't recommend using formula in those first few weeks. One is the benefits of breast milk are really those antibodies from mom, getting that immunity, getting all those health benefits. And if you're mixing it with formula, you're not getting all of that. You're also trying to establish mom's supply. So if the baby's taking formula, you're not developing that supply for mom to give the baby all the breast milk that it needs. So we don't recommend nipples, we don't recommend formula unless necessary in those first few weeks.
Sometimes there are situations in the hospital where the baby doesn't gain weight very well and the nursing isn't going well. And in those situations, we will have other ways of feeding the baby, which may include using a cup or a small tube or a pipette. Ideally, we'll try to use express breast milk that the mother has given to us, but in certain situations where she doesn't have enough milk, we may use formula for a brief period of time, but as soon as we can, we get the baby switched back to the breast milk, which we know is the best thing.
Exactly.
Thank you for delivering at NVRH. Allow me to introduce some members of our lactation services team. We work closely with our community partners in the NVRH community, and that includes St. Johnsbury Pediatrics, Family Practices, WIC, Home Health, Little Sprouts, La Leche League.
Thanks for taking the time to watch our video today. If you'd like to watch it again, you can visit the link on our website. If any questions have been raised during the video, please feel free to talk to your provider at the next visit. If you plan not to breastfeed, please talk to your provider about safe preparation of formula. Thank you again.